Another fantastic thing which people understand in their life is what we normally call in our language is anxiety. And even anxiety is something which a lot of people have, but they don't visit for a mental health professional or a mental health person or mental health counselor or a psychiatrist or a psychologist or psychotherapist even. As mental health disorder characterized with a feeling of worry and anxiety or fear that are strong enough to interfere with their day-to-day life or activities. It can be panic attack, it can be obsessive compulsive disorder, it can be social anxiety disorder, it can be post-traumatic stress disorder. A long list of things. Mostly it happens because of the irrational fear what a patient have. So everyone feels anxious now and then. It's very natural that to feel anxious. But if it is happens and it is interfering in your day-to-day life, it is not natural. It is it's irrational in some regards, and can be a problematic. Anxiety can be a normal emotion like what we have in anger, but sometimes it is more, and when it interferes in our day-to-day life, that has to be addressed, and it is very important that we should address. So like for example, in certain situation we feel nervous for no reasons, for example writing an exam or attending an interview. That's a very natural and a normal phenomenon. But unnecessary getting disturbed, for example in exam time now it is going on, a lot of children feel that they don't think about the exam, they think about the result, which actually is not probably not required at that point of time, because it is a time of exam. I have to write an exam, result is secondary, because when we write an article which is recently written, which is called as numbers cannot decide my destiny. So that means, and even if you have failed, nobody is going to ask you that which class you have failed. So there is no point in getting disturbed because of that result and anything. So the question is how nicely you take care of your mindset is very important, because anxiety can happen. For example, in panic disorders, we see a lot of people visit cardiologists saying that I have heart pain, and it's a very severe pain, and they feel that it's all sweating and it's all chest pain and palpitations increase and high BP and all. But when they visit a cardiologist, he says that nothing is there, you just have to take this medicine and you will be fine. But after a few days it again happens, and they get all these medical tests and everything comes normal. But once they visit a psychiatrist or a psychologist or a clinical psychologist, that helps them to understand that what exactly is happening and how it can be tailored, so that how it can be tackled with them, and then how they can manage the symptoms in their home itself, just having some kind of sessions with a psychologist or a clinical psychologist. Another thing is like SAD, that is social anxiety disorder, where it will be overwhelming or worrying or self-conscious about everyday social situations, like people who are afraid of climbing a lift, elevators, or the people where a lot of gatherings are there, they are disturbed with that. They are not able to face the crowd. So that can be one of the issues like that. A lot of issues like that. Recently we have seen a patient who just felt that somebody pricked, and he might have got infected with some kind of a disease, and he got into the blood test, the urine test and everything, but nothing found there. So there are a lot of anxiety or a phobia which just happens. And then there are generalized anxiety disorders where it is there and you feel excessive unrealistic worry. So normally what we call as phobia. A phobia is a fear anyone can have. It can be a natural phenomenon, but a phobia is something like irrational fear, which happens to most of the people. But it can be tackled. It can be tackled with the help of a psychiatrist or a psychologist or a counselor, which will help him to understand what is happening, why it is happening, and how it can be tackled. So like that, the symptoms can be panic, fear, uneasiness, sleep problems, not being able to stay calm, or shortness of breath, heart palpitations, dry mouth, and nausea, muscle tensions, and at times when dizziness as well. So like that, there are so many things which is going to happen to a patient, and then they need to realize that I can control, because I am the best doctor for myself. So like that, a lot of patients can manage, but not all the patients can manage it. And as for the WHO thing, it says that a lot of people are suffering with anxiety, but they don't go for help. So with this video, we like to say that there are a lot of people, if you can go to a good psychologist or psychiatrist or a clinical psychologist, which you know that it's not based on the ratings or reviews of other people. You just have to understand going them, and then make a decision that this is what, for example, when you go into a dinner or something, you shell out something, so like that you go visit, and if you feel that he is able to convince you with his whatever he is telling you and will help you out, take the call there. So like that you will come to a good specialist who is aware of, or maybe you ask a person who already went to a psychologist or a psychiatrist or a clinical psychologist. They will help you to how to find out a good psychologist or a counselor to understand or address your psychological illness or anxiety problem. That way it will be good for you to understand anxiety can be tackled without the help of other things, like maybe medication at times can be used, but mostly without medication can be handled or tackled. It depends on patient to patient. It is individual uniqueness. You cannot say that medicine is not required, you cannot say medicine is required. And a lot of things can be there. It's psychological help can be helpful, sometimes psychiatric help is also helpful. But both ways, it parallelly if goes, it will be always helpful, because both psychiatrists' way of understanding anxiety is different and psychologist's way of understanding things are different. So both ways work together, it will be a fantastic thing, because end of the day, the patient should be benefited out of this. And that which helps the patient to really understand that how to tackle things in life and without disturbing their day-to-day life, because anxiety can happen to anyone, to everyone in their life. And we need to understand that anxiety can be addressed in such a way that you need to really follow the pattern. Maybe lifestyle changes can help you a lot, and having exercise, breathing exercises. Like normally in our clinic we do this relaxation therapy. We have found a lot of patients are getting benefited because of this relaxation therapy followed by cognitive behavioral therapy. CBT only cannot make a difference, other things has to be added to it. But relaxation therapy and CBT is the best model to tackle the anxiety symptoms, and that symptoms can be managed having a good routine, because most of us cannot have a good routine or routine life. But if can be manageable, if once you are able to manage, I think things and the symptoms can be tackled at a far distance, and you will be able to live a good quality life.